We all want to be healthy, we want to feel good and have energy. One way to check on our health is to understand our BMI. BMI stands for Body Mass Index. It's a tool that tells us if our weight is healthy for our height. Knowing your BMI is important. It can help you make good choices for your health. It can also help you talk to your doctor about your weight. By understanding BMI, you can take steps to improve your health. You can make smart choices about food and exercise. You can live a longer, healthier life. It's time to learn about BMI and what it means for you. Let's get started. Cracking the code, understanding BMI. BMI might sound complicated, but it's actually pretty simple. It's a useful tool that helps you understand your body composition. It's a calculation that uses your height and weight to give you a number. The result tells you if you're underweight, normal weight, overweight, or obese. These categories help you understand where you stand in terms of health risks. There are two ways to calculate BMI. You can either do it manually or use tools available online. You can use a simple formula or a handy BMI chart. Both methods are straightforward and easy to use. The formula is BMI equals weight in kilograms divided by height in meters squared. This formula gives you a precise number that you can use to determine your BMI category. Don't worry about doing the math yourself though. There are plenty of resources available to make this easier. You can find BMI calculators online that do the work for you. These calculators are user-friendly and provide instant results. The other option is to use a BMI chart. These charts are widely available and easy to interpret. These charts show you your BMI range based on your height and weight. They are a quick reference to understand your BMI category. You can find these charts online or at your doctor's office. They are a valuable resource for anyone looking to understand their BMI. Now that you know how to calculate BMI, let's look at the different categories and what they mean for your health. Understanding these categories can help you make informed decisions about your lifestyle and health. The underweight category indicates that you may need to gain weight for optimal health. Being underweight can lead to various health issues, including weakened immunity and bone health problems. The normal weight category suggests that you are within a healthy weight range. Maintaining this weight can help reduce the risk of chronic diseases. The overweight category means you may need to consider lifestyle changes to avoid potential health risks. This could include adopting a healthier diet and increasing physical activity. The obese category indicates a higher risk of serious health conditions such as heart disease, diabetes, and hypertension. It's important to seek medical advice and create a plan to achieve a healthier weight. Remember, BMI is just one tool to assess your health. It's important to consider other factors like muscle mass, bone density, and overall fitness. Always consult with healthcare professionals for a comprehensive health assessment. By understanding your BMI and what it means, you can take proactive steps towards a healthier, happier life. BMI is divided into four main categories. These categories help you understand where you stand in terms of your weight relative to your height. Each category tells you if your weight is healthy for your height. Knowing your BMI can be a useful tool in managing your overall health and well-being. The first category is underweight. This is a condition where your body weight is considered too low to be healthy. This means your BMI is below 18.5. Being underweight can be a sign that you're not eating enough or that you may have an underlying health condition. Being underweight can be a sign that you're not eating enough. It can also indicate that your body is not absorbing nutrients properly, which can lead to various health issues. The next category is normal weight. This is the ideal range for most people. This means your BMI is between 18.5 and 24.9. Maintaining a normal weight is associated with a lower risk of chronic diseases. If you're in this range, you're at a healthy weight for your height. This is generally considered the optimal range for overall health and longevity. The third category is overweight. This is when your body weight is higher than what is considered healthy for your height. This means your BMI is between 25 and 29.9. Being overweight can be a precursor to more serious health conditions. Being overweight can increase your risk for health problems. These can include heart disease, diabetes, and high blood pressure. The final category is obese. This is a more severe form of being overweight. This means your BMI is 30 or higher. Obesity is a serious condition that can lead to many health issues, including joint problems, sleep apnea, and certain types of cancer. Obesity is a serious condition that can lead to many health issues, It often requires a comprehensive approach to treatment, including diet, exercise, and sometimes medication or surgery. Your BMI category is just one piece of the puzzle when it comes to your health. It's a useful starting point, but it doesn't tell the whole story. It's important to talk to your doctor about your individual needs. They can provide personalized advice and help you develop a plan that's right for you. Section 4. The importance of BMI, a window to your health. Why is knowing your BMI so important? Because it can give you a glimpse into your overall health. Your BMI can be an indicator of potential health risks. For example, people who are overweight or obese are at a higher risk for certain health problems. These include heart disease, stroke, type 2 diabetes, and some types of cancer. On the other hand, being underweight can also have negative health consequences. It can weaken your immune system and make you more susceptible to infections. It's important to remember that BMI is just one factor to consider when assessing your health. It's not a perfect measure and it doesn't tell the whole story, but it can be a valuable tool for starting a conversation with your doctor about your health. Section 5. Beyond the numbers, BMI's limitations. While BMI can be a helpful tool, it's important to remember that it has limitations. BMI doesn't take into account factors like muscle mass, bone density, or body fat percentage. For example, a muscular athlete might have a high BMI because muscle weighs more than fat. However, this doesn't mean they are unhealthy. In fact, they are likely very fit and healthy. Similarly, BMI doesn't distinguish between subcutaneous fat, which is fat under the skin, and visceral fat, which is fat around the organs. Visceral fat is more dangerous and is linked to a higher risk of health problems. It's important to look beyond the number on the scale and consider other factors that contribute to overall health. Factors like diet, exercise, sleep, stress levels, and genetics all play a role. Section 6. Using BMI wisely, a piece of the puzzle. So how can you use BMI effectively to improve your health? It's a question many people ask, and the answer lies in understanding the role BMI plays in the bigger picture of your overall health. The key is to remember that BMI is just one piece of the puzzle. It provides a snapshot of your weight in relation to your height, but it doesn't tell the whole story. It's not the be-all and end-all of health assessment. Other factors like muscle mass, bone density, and overall body composition also play crucial roles in determining your health. Use BMI as a starting point to assess your weight and potential health risks. It can help identify if you are underweight, normal weight, overweight, or obese, which can be a useful indicator for further health evaluations. If your BMI falls outside the healthy range, it's a good idea to talk to your doctor. They can help you understand what your BMI means in the context of your overall health and guide you on the next steps. Your doctor can help you interpret your BMI in the context of your overall health history. They will consider other health metrics and factors such as your age, gender, and family history to provide a more comprehensive health assessment. They can also recommend lifestyle changes such as diet and exercise to help you achieve a healthy weight. These recommendations will be tailored to your specific needs and goals, ensuring a more effective and sustainable approach to health improvement. Remember, health is not a one-size-fits-all approach. Each person is unique, and what works for one individual might not be suitable for another. What works for one person might not work for another. It's important to find a health and wellness plan that fits your lifestyle, preferences, and needs. It's important to work with your healthcare provider to create a personalized plan that meets your individual needs. This collaborative approach ensures that you receive the best possible care and support on your health journey. Setting realistic health goals and tracking your progress can also be incredibly motivating. Celebrate your milestones, no matter how small, and stay committed to your health journey. Engaging in community health programs, support groups, or wellness workshops can provide additional support and resources. These programs often offer valuable information, encouragement, and a sense of community. Ultimately, the goal is to feel empowered and confident in your health journey. By using BMI wisely and considering it as part of a broader health assessment, you can make informed decisions and take proactive steps towards a healthier, happier life. Section 7. Taking charge. Your health, your journey. Understanding your BMI is an important step in taking charge of your health. It can help you make informed decisions about your lifestyle and work towards achieving your health goals. Remember that your BMI is just one factor to consider. Don't get too caught up in the number itself. Instead, focus on making healthy choices that make you feel your best. Eat a balanced diet, engage in regular physical activity, get enough sleep, manage stress levels, and listen to your body. Your health is a journey, not a destination. Take it one step at a time and celebrate your progress along the way.